What's up, Warriors? Welcome back to another episode of the Suburban Warrior Podcast. I'm your host, Chrissy Pfeiffer, and I'm back this week with another amazing guest here to share his expertise with us. And I think you're really going to love this episode because we are going to talk about a lot of new technologies that are available for, specifically for women in midlife who might be experiencing things like chronic pain, joint pain, fibromyalgia, musculoskeletal issues, which is one of a really big issue for a lot of women in midlife and aren't finding answers. So I'm really excited to talk to him about all of these new technologies. But first, let me remind you to go to suburbanwarriorpodcast.com and be sure to sign up for our weekly newsletter. It is basically all of the tips and tricks that we share on the podcast delivered right in your inbox. And you can also download the free From Pause to Power Roadmap, which is all the advice I wish I had 10 years ago when I started this perimenopausal journey. So let me introduce to you today Dr. Sean Altman. He helps patients avoid unnecessary surgery by combining a root cause clinical method with non-surgical technologies, an approach he's used for more than 15 years to reverse chronic pain, restore function, and get competitive athletes back to play. As a functional medicine doctor who spends an hour or more on initial visits, he diagnoses the underlying drivers of musculoskeletal and neurologic symptoms and builds targeted plans that use frequency-specific microcurrent, advanced manual therapies, and shockwave protocols to produce lasting results. Welcome to the podcast, Dr. Altman.
Thanks so much for having me.
Absolutely. Like I said in my intro, I am really excited to have you on because I think we're going to talk about a lot of technologies that are available to people that we don't really know about because maybe they're not recommended or spoke that much about in traditional medicine. And obviously, my listeners, they're women in midlife. What do we do when we have musculoskeletal pain or when we have joint pain or frozen shoulder or any of these sort of ailments that we start to get in midlife? We go to our traditional physicians, and a lot of times nothing is either anatomically wrong, nothing's showing up on scans, blood work looks good. So we're sort of at a loss of what to do, especially when it comes to chronic pain. So I'm really excited to talk about this topic today because there are options for us out there, and you're going to tell us about them today. But before we get into that, tell us a little bit more about you and sort of how you got into functional medicine and all of these new technologies and why you're so passionate about them.
Sure. So my background, I started off working in a complex chronic pain clinic with older patients with a variety of different issues, some perimenopause, some menopause, some, chronic Lyme disease, autoimmune disease, fibromyalgia, basically people who had really struggled with pain for long periods of time, and were not getting, information, they were getting negative imaging scans, or they were being told things weren't wrong, or the medical system really didn't have, an answer for them. If you have a patient who has, severe pain in both knees and both hips, you're not going to replace one of their knees. They're not going to be able to do too well with that type of, issue. Right. So it really inspired this outside of the box, systems-based thinking, that, began with a study of functional medicine, but then really just evolved to me trying to understand the why behind kind of everything. How does the nervous system work? Why is someone's nervous system not functioning adequately as opposed to that other person? When we talk about things like chronic pain, and I'll qualify that because most people don't know what chronic pain means. So chronic pain is basically having a persistent pain for more than 3 to 4 months. Yeah. When that happens, the nervous system becomes hypersensitized to that pain. Those nerves become more inflamed, more energized, more active. And then you get to a point where your perception of the pain is exaggerated. It's more than the actual, imaging might reveal. But it's a real documented, calculable scientific process. And, understanding how that works and how other things can influence it helps me to help a lot of these patients. When we talk about people in like perimenopause, hormones, body changes, all of those things can affect how these systems work, can cause, their own little energetic crises. And they certainly predispose, those individuals to develop some of these ailments that maybe in other periods of life they might be able to resist or, address more effectively.
Yeah. And, thanks for explaining chronic pain, because I do think, I actually, when I was in pharmaceuticals, I worked in the chronic pain space for years. And it is fascinating because everyone thinks like, oh, it's pain. But people who live with chronic pain, it is completely debilitating. You really can't, your whole life is interrupted, besides the fact that you are in chronic pain. And, there's all different types of pain. And like you said, it sounds like, oh, we're just in pain, but it's about getting to the root cause of the pain. And then your whole body, all the different systems in your body are trying to compensate for this pain that you're in. And it really becomes a very complex ailment to treat. It's not just like, oh, I'm in pain. It's like you said, three months or more. Some people are in chronic pain for years before getting any relief. So it truly is a debilitating issue. And, whether it's full body pain, a couple joints, chronic migraines, whatever it may be, being in chronic pain is completely debilitating. And, anyone who has been, that the first thing you want to do is just get out of pain because it interrupts every facet of your life. So, and, there's really not a ton, besides getting to the root cause, which is what we're going to talk about, there's not that many options besides your NSAIDs and your opioids. And opioids, they have their whole set of issues in itself because it's very difficult to be on those type of medicines long term.
And then from the NSAIDs, our new emerging evidence suggests that long-term NSAID use can permanently damage the inflammatory process, which, to kind of boil that down into layman's terms, means that if we use NSAIDs too much, we may get to a point later in life where our body is not able to go through a proper inflammatory response, which means that we lose the ability to heal from basic injuries.
Yeah.
We lose the ability to fight off infections. There's a real cost that could be associated with this, and certainly not one that the pharmaceutical industry is going to tell you about. So my approach is really trying to harness our own body systems to heal ourselves and to get to those deeper issues. And I think by framing it in that lens, it makes you feel more, powerful and less helpless. You're actively involved in this process. We talk about all the time how one of the best things for the body in terms of longevity is exercise, and especially strength training, weight training, for things like bone density, which tends to affect women in the perimenopausal age, which
Absolutely.
That kind of inspires me to talk about technology. We've gotten really good at looking at body composition, bone density, et cetera. And that's something that I think is really important to track, and to track more frequently than, say, is recommended by the traditional establishment.
Absolutely. So talk to me about those technologies. I'm sure there's in-office ones that are a lot, more high, technical, but I mean, even the Hume scale is something that is available just to people at home if they wanted that, which is a body composition scale, which is amazing, and measures bone density, muscle mass, in addition to weight, BMI, and all those things. So talk to me about those, this new technology that we have to be able to look at our body composition, and how do you use that when you're evaluating patients? Absolutely.
So I'm a fan of the Hume scale. I think it has a lot of good data that comes out of it. We have patients go for what's called DexaFit scans. So that's a more, office version of the DEXA.
Okay.
And then recently I've actually added the Staiku machine, which is a three-dimensional body analysis to my practice, which is very, very good at estimating bone density. Their current algorithm is about 98, 99% within that of the DEXA scan. And the goal with all of these is to track the trend.
Yeah.
It's not just to get one measurement, it's to look at what's happening to the body as a whole, both from bone density, but also circumferential measurements, proportion of the body, like, muscle mass, visceral fat, all of those things.
Yeah.
And we really, really emphasize it in the perimenopausal women. And then we mandated actually in my office for any people who are doing GLP-1s, any people who are doing weight loss, because if you're not getting adequate protein, you're not getting adequate strength training, we do see, loss in muscle mass and sometimes loss in bone density as a result of just, not living a healthy enough lifestyle.
Yeah.
And I want to be able to catch that early in patients and get them on the right trajectory, and catch it in, say, 3 months or 6 months instead of a year. Because by a year or 2 years, lots of things have happened. It's harder to reverse that, and it's harder to get back on track.
Yeah, absolutely. Okay, so let's talk about some of the other technologies that you work with, especially for maybe chronic pain, or musculoskeletal pain in general. Is it Softwave that you're using?
Mm-hmm. Yeah, so Softwave is a type of electrohydraulic shockwave therapy.
Okay.
And it's useful for treating, tendon injuries, joint issues. It'll treat arthritis. It'll treat vascular compromise, so like chronic inflammation, blood flow issues to a particular area.
Okay.
Like say if your ankle swells up frequently from multiple injuries, and we've classified it as a regenerative modality because
Oh wow. Okay.
because not only the repeated stimulus of those shock waves, it stimulates the release of growth factors and various cytokines that come to that site of the treatment. And it inspires and provides requisite energy for a regenerative process to take place.
Okay. So people that sustain injuries, whether it's like sprained ankle, how about like an ACL, like all of those type of maybe more athletic performance, or whatever, it could be just tripping, and you injure yourself. But so as part of the healing process, getting these soft wave treatments, which I believe are kind of short in duration, right? They're like
5 to 8 minutes. Yeah, they're pretty short. I mean, I will stack it with other energy modalities like laser therapy or FSM, if it's warranted. But yeah, they're not long treatments, but it helps to get the body on track. And we're finding that there's a lot of people that can benefit or, can even get complete healing and relief from these, non-invasive modalities, as opposed to even in, minimally invasive things like, PRP or stem cell injections, which also work, but it's just, how much time or money do you have, and, and seeing what best works for the body. But it's all through this lens of the functional medicine, which is the body capable of healing? Is there something preventing the body from getting better? Because at the end of the day, if that's taking place, the soft wave's not going to work. Nothing's going to work because the body isn't going to allow the healing process to complete. And that's where we end up with a lot of these chronic inflammatory issues like tendinitis, bursitis, all the itises, is that there's some issue in that particular area, and often systemically that keeps the body in a permanently inflamed or a moderately inflamed state, and it's not able to get beyond that inflammatory state.
Yeah.
So it's important to I think to look at that first, to optimize someone's healing potential before we even do stuff like that. And in orthobiologics, which is basically like a term for people who do PRP stem cell therapies.
Yeah.
They have this new term. It's called MOBOT, metabolic optimization before orthobiologic treatment.
Oh, wow.
So
I
it
love
basically
that.
means optimizing them in terms of their nutrition, their exercise, their sleep, their mitochondrial activity, so basically like their energy and their nervous system before doing a procedure. And when you do that, it's not surprising, the likelihood of success goes way up.
Yeah.
Because you're setting the table before you move forward.
Yeah. And that is like, that's wonderful, because that's like such a shift in sort of where medicine is, right? So, I mean, really setting the stage, setting the body up, making sure the soil is, healthy and ready before you start growing everything, or just throwing, technologies or procedures or surgery to fix something that, just healing from may be very difficult. So, so something like, women in menopause or perimenopause a lot of times experience frozen shoulder. So even something like frozen shoulder, same thing. Like you could use this type of soft wave technology to sort of help to heal that.
But you want to address if there's it doesn't come out of nowhere.
Right.
There's a reason why the frozen shoulder happened. It could be a purely hormonal related frozen shoulder, in which case, hormone imbalance causes the connective tissue within the capsule of the shoulder to be more adhesive to itself. It sticks to one another.
Yeah.
In which case you would want to, optimize hormones as well, in order to prevent it from happening again. So that would be like scenario number one. And then scenario number two, which is also an equally important one, is did the frozen shoulder happen as a result of an underlying pathology? And what we are finding now is that on average about 60 to 70% of frozen shoulder cases have underlying ligament or labral pathology under the surface. So there's an injury, and now the tightening it's a self-limitation, self-tightening. It's really like a protective mechanism.
Yeah.
Like if a joint hurts, you're going to limit how much you move that joint. And having that injury coupled with the hormonal changes obviously makes it much more likely for it to freeze. So that's why in my office, technology-wise, with any orthopedic case, I'm doing ultrasound imaging to verify, that there isn't an underlying issue before I start to mobilize and loosen up the adhesions in that joint. Because if it's protecting something, and that's where you may have heard cases of people who, have their shoulder worked on, they have frozen shoulder, and then it tightens right back up.
Yeah.
And most of the time that's because there's something under the surface that tightness is protecting against. So what I've learned, is knowing the why.
Yeah.
Once you understand the why behind a lot of these issues, it becomes much easier to treat, and the success rate goes way up.
And so when you do treat, assuming like maybe they might need some hormone therapy, maybe they might need, some type of, treatment like the soft wave, or when you do treat, are you seeing success from the treatments that they are
Absolutely.
able to?
Yeah.
Yeah.
No, across the board. It'll vary how quickly they get better based on what the underlying diagnosis is.
Yeah.
So if it's just a simple, hormone related, adhesion, that would break up relatively quickly. And then we would also make sure that we optimize everything else in the background, because there's other processes that need to be addressed. And the fact that it tightened up was really like a symptom of a metabolic imbalance as well.
Yeah.
So that would be, quicker. If there's an underlying injury, now we need to get that injury to heal and then loosen it up. And, that may take a little bit longer. But, I use technology to accelerate these processes as much as possible, because by providing energy and support to the body, it heals faster, and sometimes much faster. You mentioned ACLs earlier. This year alone, I've helped 5 people heal complete ACL tears without surgery, using energy modalities and a bracing protocol.
Wow, that's amazing. How long is that healing time? How long does that
So
take?
all of them were back running, pretty much full activity at 6 months.
Wow.
Which is obviously way faster than a surgery. And it
Yeah.
makes sense because surgeries have more limits in terms of what you can do, and it takes time for scaffolding and the graft to take and healing and all of that.
Yeah. So even
And that's
complete
something we
ACL.
know just in general is the body will always heal itself faster than a surgery might. It's just not, now we are realizing that there are many, many more injuries that surgery can be avoided in because of the advancements we've made in technology.
Yeah. So tell me, are there different technologies like within Softwave? Are they called different things? Like what are the technologies that you work with specifically?
So I use laser therapy, red light therapy, shockwave, frequency specific microcurrent, PEMF, manual therapy, taping, acupuncture. It's it's a long list.
Yeah. Okay. And you use basically multiple
What works
therapies.
for the person. It's a
Yeah.
very like tailored approach.
Yeah. Yeah.
I in some ways I think of my office like a workshop,
Yeah.
where I have to find the right tool for the right person.
Right. Well, it makes sense because, right, we're all bio-individual. And even though one person may have, two people might have the same exact injury, their root cause may be different and how they respond to certain treatments may
Absolutely.
be different. So your goal when working with all of the, with your patients is always to sort of use the most minimally invasive technologies first.
Yes,
Towards
exactly.
healing, right?
My close friend is a naturopath.
Okay.
And he's inspired, a number of the things that I've looked into and learned over the years. And years ago, he told me one thing that really stuck with me. So the Hippocratic Oath, do no harm.
Yeah.
The way that naturopaths interpret that oath is, and I quote, to help the body heal with as little bodily discomfort as possible.
Yeah.
Now, that should be everyone's motto.
Right. Right.
Getting better with as little discomfort as possible.
Yeah.
I mean, and that really kind of defines what I try to do. Is I try to have as many tools and ways to help the body heal itself so that it doesn't need as aggressive or painful of an approach.
Yeah.
You don't always need a hammer.
Absolutely.
There's other ways, to get there.
Yeah. And what about women who, or maybe men as well, but patients, I should say, that you've seen that might have come in maybe with like fibromyalgia, or type of like autoimmune pain, chronic, just sort of all over body pain. Do these technologies help for them?
Yes, absolutely. So first we have to figure out why, that particular issue is going on.
Yeah.
And if it is something, like a true fibromyalgia is, it's central sensitization. It's a, central nervous system, peripheral nervous system that's overstimulated, despite there not being significant pain or it's not significant injury in those joints. So,
Right.
What I do is I use bio and neurofeedback mechanisms to retrain the body to calibrate those systems appropriately so it's more in line with the actual level of injury and pain. And then once once the body learns, and learning is all about feedback, so multiple times of feedback, and then the nervous system starts to learn and to learn a new normal, and then that ultimately will become the body's new normal. And then the pain levels will, they'll either go away entirely, or they'll go down to like the normal level. And then if there is residual injury or issues, then we obviously address those along the way.
Yeah. It's pretty amazing when you think about how you can train the nervous system, right, to just recognize pain in a different way, or, and so that it's not as impactful in your life, and then all of a sudden you're pain-free and that sort of thing. Talk to me a little bit about, so, when your patients come in, you obviously are evaluating them. Like you said, there's, everyone's different. Let's see what tools in the toolkit everyone needs. Then you're using your tools to see, how you can fix the underlying issue. And then what? Like what? Because obviously lifestyle, metabolic health, all of these things make such a difference in how you are not only going to heal, but make sure that it's not going to reoccur, or you're not going to sustain another injury. So talk to me about what you do, or what the importance is for you about lifestyle and habit changes.
Absolutely. I would say over the first few sessions, discussing lifestyle factors is really important, because those are the things that can have a more immediate effect, altering someone's sleeping cycle, getting them to eat a healthier diet, exercise more frequently, get a little bit more sun. Like, these little changes that you make can really improve the body's ability to function, to heal, to do all of these things. It's important to have the patient be actively involved in their treatment, and just to understand the power of what little changes can do in terms of their, the benefit they can get from them.
Yeah. And do you see your patients being pretty compliant with those changes? Because
Yes.
I'm assuming they start to probably recognize and see differences in how they feel. And so it's a little bit easier to stay compliant when you're changing, habits that are hard to change. But do you see your patients able to, sustain a different lifestyle, like eating healthier,
Yes.
moving their bodies more?
Yes. I mean, I think the goal is to look for lifestyle changes that are achievable, that are, able to meet long-term demands, not excessively rigid, restrictive changes that, will in all likelihood not stand the test of time.
Yeah.
So it's a dialogue, it's a conversation, and that's why I said it's over the first few sessions, because, I think psychology plays a big role in this. There are some people, from a compliance standpoint, that they need to be convinced of the merit and of the benefit of these things, and others that they're already up to date. They've read the books. They know they just need a little bit of direction, but they're ready, willing, and able to make the changes that are needed.
Yeah.
So it's definitely a process. Each individual is different in terms of how much we can change and how compliant they will be going forward. But I think it's important for them to understand the causality behind these things, and how that they've often influenced what has gotten them to this point. And the way to stay out of trouble is to stay away from certain things as well going forward.
Absolutely. What is your opinion on, what do you think is the most significant driver of, metabolic health, chronic inflammation? Is there one thing that, obviously there's not one thing, but in hierarchy, do you see the biggest change in one of those factors? Where would you start with patients?
Sleep.
Sleep. Interesting. Okay, sleep. I like it.
I think it's the simplest, but it's also probably the most important.
Yeah.
Because quality of sleep, that's when we, from an energetic standpoint, our body recharges, it regenerates, it's restorative, it's reparative. And if there's an issue with sleep quality, now you create an energy deficit. With my patients, I like to use the analogy of like a battery. You're recharging that battery, and if the plug is loose or the battery's not charging well, and you wake up in the morning and you're at 80%, and then the next morning you're at 60%, and then the next morning you're at 4. It's problems they're gonna build up, and then if new problems arise, your body is ill-equipped to handle the new ones that come in as well.
Yeah.
So that's something, right off the bat, I ask about really the two principal systems. So that's sleep quality and then gut health. How's your digestion? How well does your gut function? That one tends to be more complicated and more time consuming, and often there's testing and things that need to be looked into. So I find that sleep is the best thing to start with, because it does tend to be a little bit simpler. And maybe you don't solve it, but you might be able to make small adjustments in terms of sleep position, sleep timing, routine, etc. Things that could, provide even like a little bit of a boost in sleep quality. And that may move the needle, in many ways just by doing that.
Yeah, no, I love that. I totally agree. I think there's just so many different aspects of sleep that you can address, that, just are kind of factor into when you sleep, how you sleep, all of those things, the quality of your sleep. So I love that. And I think that's really, really great advice for everybody to, start really focusing on what that, restorative sleep looks like, and are we getting rest? Because our bodies can't really function and repair when we're not getting any restorative sleep.
And with the technology today and the accessibility of the wearables, we can track our sleep.
Yeah.
And patients always ask me, oh, well, how accurate is this one? And how accurate is that one? Kind of like we were talking about, the Hume scale versus others.
Yeah.
But the bottom line is, as I said earlier, we're tracking progress, we're tracking trends.
Yeah.
And what we've learned is with the Apple Watch, the Fitbit, all of those, the intra-rater reliability of them is pretty high. So the ability to detect clinically significant change is there. So while the measurements may be slightly off in terms of like if you did a formal sleep study, the ability to detect change between those measurements is pretty good. And if it's something that you're tracking consistently, you can supplement that with the formal scans in order to get more detailed information.
Exactly.
But it's good to be able to track these things and to, make connections in terms of what affects your sleep quality. And the wearables are really helpful with that. Like we talked about, like small changes. I will have patients that will notice that their sleep quality changes if they eat after a certain period of time at night.
Yeah,
or
totally.
if they have alcohol after a certain period of time.
Yeah.
And they wouldn't know that without the ability of the wearable to tell them that. And making those connections, that can be tremendously beneficial in terms of their overall health and outlook and, and such.
Absolutely. I noticed, I for a long time was wearing an Aura ring. I don't anymore, just because I feel like I've gotten myself to a place where I don't really need it. But when I was tracking, that's the funny thing. Like I did notice, like if I ate a late meal, it was it affected my sleep, my HRT, like everything. HRV, everything, as if I was drinking.
Yeah.
So eating a late meal was just as bad as drinking alcohol. And I was like, well, that is such a bummer. But I would never have realized that if I hadn't been tracking it. So I think that it is really important, especially for a period of time when you're really evaluating, maybe your habits, or looking at, you're in a place where you're not feeling well and you wondering why. It could be like simple habits that you do that you're not really even, aware of. You think you're doing all the right things, but just a few things could really help to tweak it.
And it picks up on individual differences. Like, for instance, that late meal affects you, but then there may be, 10 people your age, similar demographic, et cetera, that it doesn't. and
100%.
and knowing your body, knowing what triggers there are, how to adapt your lifestyle to fit your individual biology is the key here.
Absolutely. Absolutely. Totally agree. We are all different. So what works for me may not work for you. And it's so important to understand your own body. So where is your practice?
It's in Stamford, Connecticut.
Okay. So you're in Stamford, Connecticut. And what, so obviously, I guess you're not doing telehealth or remote because a lot of the things that you do are hands-on.
Yes, but I've started to do even just more like counseling or diagnostic evaluations, via telehealth.
Okay.
Even just to point people in the right direction of
Right.
making sure they're getting the right testing done, actually revealing, and finding out what the root cause is. Because yeah, I mean, there's not a lot of people out there that do what I do and,
Yeah.
look at the body through that lens.
Yeah.
And I don't think that's going to change in the near future.
Yeah.
My goal with social media and with, helping others and such is to change the way that the patients, change the way that people think of their health,
Yeah.
and get people asking these questions, get people holding their medical team accountable and making sure that they're really going after these deeper root cause related issues, and that they're not just trying to manage their symptoms, and go after what's really, really wrong.
Yeah, absolutely. So tell my listeners where they can find out more about your practice.
Sure. So my website is drshawnaltman.com.
Okay.
There's lots of good information on there. You can reach me through the website. There's a contact form. And even if you just have a question or something popped up, I'm happy to, I'm very big proponent of just sharing information, knowledge. The more we know about our bodies and our health, the better equipped we are to take care of ourselves and to get better from, anything we might be dealing with.
Absolutely. I couldn't agree more. I love that. We are educating and empowering every person to just take charge of their health, right?
Yeah.
Yeah, absolutely. Well, thank you so much for being on the podcast today. I really enjoyed our conversation, and it's really so wonderful and exciting to know that there are all these other therapies out there that are functional therapies, that are non-invasive, that we could be using when we have pain, when we are sustaining an injury to help heal ourselves. So guys, be sure to check out drshawnaltman.com. We'll link it in the show notes, and learn about all of these alternative therapies that are available, because I'm sure that there are some around where you live, and you just have to sort of be educated to be able to know that they're available and find them. So thank you again for being on the podcast, and I'll be back next week, guys, with another amazing Suburban Warrior here to share their expertise and story with you. Until then, talk to you soon.